It has been a year Monday since the first case of COVID-19 was identified here in British Columbia. And I know for all British Columbians, this has been an unprecedented year of hardship, for many, an unprecedented year of grief, and for all of us, extraordinarily challenging as we've met a global pandemic head on, together, focused on making sure that we're keeping our most vulnerable citizens safe, and all of us working forward to that day when we can get back to something resembling normal. And although the pandemic has hit us all very, very hard, it has not hit us equally. Over the past 6 weeks, we have been able to immunize 100,000 British Columbians, starting us on the road to putting COVID-19 in our rearview mirror, but we are far from off the track. We have a long, long way to go. And today we're going to talk about how we as British Columbians can all work together to get to that objective that we all share of a province free of COVID-19, where we can get back to where we want to be as individuals, as families, as communities, and as a province. At the outset, I want to also thank the countless numbers of frontline workers, whether they be in our healthcare sector, whether they be in on supply chains and logistics to get food to our tables and to protect people in our communities, day after day, week after week, month after month, as we've struggled through COVID-19. Today, I'm very, very happy to announce that the plan forward is one that will put 4.3 million British Columbians in a vaccinated situation by the end of September. Dr. Henry and public health experts have designed a plan that will make sure that we do everything we can to follow the science, to protect those most vulnerable, and focus on saving lives. At every step, our plan puts the health and safety of those most at risk first. Everyone in British Columbia, as I said, has been affected by the pandemic, but we are not all equally vulnerable to the virus. And the science is very clear. The single biggest factor for death or severe illness is age. Someone over the age of 60 is 5 times more likely to be seriously ill or die than someone under 45. And that means no matter where you work, no matter what you do, your age is the predominant factor, and that's been the focus of the development of this plan. As I said, in December, we started vaccinating long-term care residents and the people who care for them. Most of them are severely at risk, and that's why we started there. The next phases of our plan will follow this very simple principle. Beginning in late February, where more vaccine comes available, we will be moving to the next phase, and Dr. Henry and Dr. Ballin will talk about that. In March, we'll start to ensure that those that are eligible will be able to pre-register based on age to get access to the vaccine. And then when we get into April, the general population will mean large-scale vaccination programs across the province, where we'll utilize our arenas, our convention halls, our community centers to make sure that we can get everyone who wants a vaccination a vaccination. In some rural areas, we may well use mobile teams to ensure that we can get to everyone in every corner of British Columbia, so that by the end of September, everyone who wants a vaccination will have one, and the community immunity that we're all striving for will be a reality. Well, it needs to be very, very clear that this plan depends on a consistent supply of vaccine. That vaccine has been disrupted, and next week and the week after will be a challenge for us based on what we had anticipated to receive from the federal government and what they're able to provide us. But I want to say at the outset, blaming anyone for that is not helpful. Blaming the federal government will not get one more vaccination delivered in British Columbia. I believe the federal government is the appropriate body to procure vaccine for the entire country. That was agreed on by all premiers from across the country, coast to coast to coast, and that is what we're doing. We've run into a snaggle in Europe. That's a problem not for the federal government, that's a problem for Canadians, and we need to stand fast and ensure that we get the vaccines we deserve, that we paid for, and get them into people's arms as quickly as possible. When shipments begin to arrive of new vaccines that have not yet been approved, that will allow us to amend the plan. And again, Dr. Henry will talk about that in a moment. But I want to just reinforce, and we see this in the United States with the emergence of a new federal government and the election and the inauguration of President Joe Biden, that science is taking the front row again in the United States. British Columbians have always been focusing on the science, making sure that experts are giving advice to Minister Dix, myself, and our entire team to make sure we put the health and safety and wellness of British Columbians front and center all day, every day. And so to keep with that, I want to ensure that we're going to be making sure that you get what you need, but you also need to do your part. You need to continue to follow public health guidelines. Those have been challenging for some, but they have produced positive results for British Columbians. We need to continue to do that. We need to continue to wear our masks. We need to continue to make sure we're staying a distance from people, particularly vulnerable populations. We follow those directions, we get our immunizations, and British Columbia will be back to where we want it to be. And with that, I'll ask Dr. Henry to come up and begin the presentation, and she'll be followed by Dr. Ballum.
Thank you very much and good morning. So today I have the pleasure of talking about our BC's COVID-19 immunization plan, our strategy to roll out what is the largest immunization program in our history. Today we'll be outlining this plan to make the COVID-19 vaccine available to all eligible people living in BC who want to be vaccinated by the end of September, and focusing today on the plan that will start in April when we move to that mass vaccination, that population protection phase of our plan. There are approximately 4.3 million eligible people in British Columbia, and right now the vaccines that we have require 2 doses. So that is 8.6 million immunizations that need to be done in the next few months. We will do this based on age, starting with our oldest citizens first, who are most at risk, as we know and what we have seen for the past year, and going through to our young adults in the province. Today we're setting out an approximate timeline of when you can expect to be vaccinated. We'll be establishing clinics around at about 172 communities all around British Columbia. They will be set up in March by health authorities in partnership with local communities, municipalities, businesses, volunteers. This is going to be and needs to be an all of BC effort to make sure that we can protect those most vulnerable and then everybody in our communities. As mentioned, we'll also be using mobile sites where necessary and home visits to support those who are unable to go to clinics. And we'll be undertaking a province-wide communication effort to make sure people are informed about these clinics. And in March, you'll have the opportunity to pre-register, to sign up for appointments, which based on age, through your mobile device, computer, or by phone. So we know that the Government of Canada has committed that every Canadian who wants to be vaccinated will have access to vaccine by the end of September. To date, we've done over 100,000 people in British Columbia, those who are most vulnerable to severe illness or to death from vaccine. And most of them have received their first dose, and we now have several thousand who have received their second dose. The COVID vaccines that we have in Canada that have been approved by Health Canada, we know are safe and effective and save lives. To date, we have two vaccines, the Pfizer-BioNTech vaccine and the Moderna vaccine, both of which require 2 doses. And our mass immunization program, the population protection program that will be starting in April, is based on these vaccines and what we have been committed to receive here in British Columbia over the next few months. So it starts with, we have 6 million doses of vaccine for Q1 from January to March, and we did receive early access to some of this vaccine in December, and we started our immunization programs in December. But that is early access to the same amount of vaccine that Canada has expect between now and the end of March. Starting on the 1st of April in Q2, we expect to receive 20 million doses of vaccine, and in Q3, 45 million doses. So our plan is based on these expectations. For us here in British Columbia, that has meant from December until the end of March, we expect to receive just under 800,000 doses of vaccine. And then from April to the end of June, another 2.6 million doses. And finally, from June to September, about 6 million doses. As you can see, once again, these are back-end loaded, so our plan takes that into account. We also hope and expect that other vaccines will become available as we go through the next few months. Particularly, we know the AstraZeneca vaccine, which is a viral vector vaccine, is under consideration by Health Canada. And if and when it comes online, it is a little bit more flexible in that it is a fridge-stable vaccine. So we'll be able to add that in addition to the plan that we're presenting today. But right now, we're basing it on what we know or what we expect to receive in the next 6 months here in British Columbia. So as we said, our population to be vaccinated is about 5.2 million people in the province. Right now, none of the vaccines that are in the pipeline or have been approved are approved for use in children under the age of 18. And that's approximately 900,000 young people here in British Columbia. So our population eligible right now is about 4.3 million people. We expect, as of April 1st, that we'll still have about 4 million people still need to be vaccinated. Around 600,000 will be people who receive their first dose between December and March, and the balance are people who will need 2 doses. So that takes us to about 7.4 million doses that we'll need to provide to people in BC between April and September. Our immunization plan is based on evidence and data and focused on immunizing people who are most vulnerable to the virus first. And we know that the single greatest risk factor for severe illness and death from COVID-19 is increasing age. And that risk increases exponentially after age 70. And we see that every day, every week in our data. The approach that we have increases protection for those with very severe risk factors as well, as these also increase with age. We have been looking at this question in some detail across the country, internationally, and of course here in British Columbia as well. And early on, the National Advisory Committee on Immunization and here in BC, we had put out some large groups of people, including essential workers and people who need to be at their workplace. We now know that with the way the vaccine will be arriving in British Columbia and in Canada, and with the risk that we're facing, that the most appropriate approach right now to meet our goals of reducing morbidity and mortality, so sickness and death from COVID-19, is to use that overriding risk factor of age. We know that adults older than 60 have at least 5 times increased risk of hospitalization and death compared to those less than 45 years of age, and in particular people over 80 have double the mortality risk of even those in the 60 to 65 year age group. Using British Columbia data, we've looked at all of the different aspects. We know that people with single risk factors like diabetes, like chronic kidney disease, high blood pressure, ischemic heart disease, COPD, are more likely to have a more severe illness. But that is compounded by age. And when we look at our population, the probability of having those underlying chronic conditions also goes up with age. And we can from the data here in British Columbia, both the proportion and the numbers of people with chronic underlying medical conditions is also highly associated with age. The one that is the most associated with younger age groups is asthma, but we do know that it's actually severe uncontrolled asthma that is the greatest risk, and that is one that goes up with age. And when we looked at this data and put it into models here in British Columbia, using the hospitalization data that we have here, we know that there is slightly increased risk with a number of these underlying conditions, but overriding all of that is the risk with age. So going in an age-based model captures the majority of people with underlying risk factors first. So here we have the age bands that we have here in British Columbia. As you can see, we have 250,000 people who are aged 80 or over in this province. Many of them will be, or a proportion of the group will be people who live in assisted living and long-term care, who will be covered in phase 1. But we have a large group of community dwelling seniors who will need to be provided with vaccination as soon as we're able to. And that group of people will be eligible later in February. We were hoping it would be earlier, but now it's going to be later in February and into March. And with the shift in not providing first doses in February because of the delay from the Pfizer vaccine in particular, we are looking at into the later part of March, hopefully being able to start immunization in people in the 75 to 80 year cohort as well. We will be doing it by birth cohort, which means people born in the birth year of 1941 and earlier would be the first people eligible to receive vaccine starting in late February and early March and going down from there. And I'll now turn it over to Dr. Ballum to provide some more details about the plan as we move forward.
Thank you so much, Dr. Henry and Mr. Premier. What I'm going to do is just walk you through a little bit more detail about this high-level phase plan, and as I'll share with you, there will be more detail coming in the coming weeks. There will be 4 phases for immunization, and as you've heard, based on expert advice and guidance from the National Advisory Committee on Immunization, BC's Immunization Committee, and public health leadership. It is based primarily on age and focused on protecting people most susceptible to severe illness and death from COVID. Focus of phase 1 and 2 is protecting those most vulnerable to severe illness first, and then phase 3 and 4 on vaccinating the rest of the broad public. We are currently in phase 1, which started in December and will continue to the end of February. Phase 2, February to the end of March. Phase 3, April to June. And phase 4 from July to September. And of course, these phases may vary a little bit depending upon flows of vaccine, but this is a very good platform to start from to get ourselves organized. So really, phase 1 and 2 are the high-risk population, and phase 3 and 4, the broader general population. So what I'm going to do in the next few minutes is just walk you through the details of these 4 phases. This is a summary slide, but I'll take the next slide and just start you with the details of phase 1. This is the current phase we're in, and I think you're aware we started in December 2020, and it will be ongoing through to likely the end of February. And we have had 2 approaches in this part. First, to protect residents and staff of long-term care facilities, of assisted living residences. As you heard from Dr. Henry, these are our highest, most vulnerable risk patients. We also have individuals who are also vulnerable and frail, waiting for long-term care, and essential visitors who are coming into our long-term care homes, our assisted living homes, to actually help their loved ones and family members be cared for and have the necessary care throughout the day. The other aspect of this first phase has been protecting our healthcare system and protecting, in order of priority, our healthcare workers and medical staff who are basically caring for COVID patients requiring admission to hospital. So settings like intensive care units, our emergency departments, and in the number of hospitals across the province that we have established as our COVID treatment hospitals, we have special COVID wards on those units. And then following on, our paramedics, our broad medical surgical units in our acute care hospitals. And the other part of this first phase is vaccinating our First Nations residents in remote and isolated Indigenous communities. Because as you've heard from Dr. Henry, our First Nations have a higher risk according to, even when compared by age. And when they're living in remote and isolated communities and become ill, it is a logistical challenge to ensure that they get to safety. So that in essence is phase 1, which is still underway, and our hope is that vaccine supply, pending, that we will be able to finish that up toward the end of February. Moving on to phase 2, which is February to the end of March. In this part of the phase, we will be able to reach out to the 80-plus age group who have not yet been immunized in phase 1. And these are people that are, in independent living and living in community, in homes with their family, or even on their own. So that will be the first broad population group that we will be looking at for immunization. We will carry on with immunization of Indigenous seniors age 65 and over, and Indigenous elders, and additional Indigenous communities that we were not able to get to in phase 1 that are isolated and remote. We will continue to immunize hospital staff that have been working in some of the lower risk areas of our acute care system, our GPs and medical specialists, nurse practitioners who are working in the community who have not yet been immunized in phase 1. There are vulnerable populations living in congregate settings, living in shelters, and those kinds of very vulnerable situations that we will also be working to cover off with vaccination, and staff in community home support and our nurses who are going into individual homes across our province in our home support and home care programs. So this is phase 2. Moving on to phase 3, this is when we will start to broaden our reach into the general population. So from April to June, as Dr. Henry has outlined in age increments, we will start with people aged 60 to 79 in 5-year increments. 79 to 75 will approximately, they'll get their first shot in April and their second dose following 5 weeks later in May. 70 to 74, first shot in April, same thing, second dose in May. When we get to the 65 to 69 year age group, we will be shifting. Probably half of them will get their first dose in May or June, and their second shot 5 weeks later in June and July. And for those 60 to 64, we will likely not get to them until June. They'll get their first shot in June, and they will be running for their second shot in July. We will also be looking at a group of people aged 16 to 69 who are considered extremely clinically vulnerable. And we will be lining them up with the group aged, 70 to 79 and perhaps younger, as we try and reach that group of individuals through this early phase of phase 3. And as additional vaccines are approved, and particularly ones that have less logistical constraints in terms of how they need to be stored and how readily they can be transported, that's when we may be able to look at people between the ages of 18 and 64, particularly the frontline essential workers, or who work in specific high-risk workplaces or industries. We may be able to include starting them off in phase 3, and that's still to be determined. I just want to walk you through our clinically extremely vulnerable patients. I think that Dr. Henry has outlined that vulnerability does increase with age and with chronic disease, but this is a group of specific individuals who have been solid organ transplant recipients who continue to be taking very immunosuppressive medications, people with specific cancers who are undergoing active systemic chemotherapy, or, for example, people with lung cancer who are receiving radiation to their lung, people with bone marrow and blood cancers who have received bone marrow transplantation or at any stage of treatment for those conditions, people who are receiving immunotherapy designed to suppress their immune system for treatment of cancer, or other antibody treatments for cancer that are more common nowadays, and other targeted cancer treatments, some of our designer drugs for cancer that have specific immunosuppressive activities. And people who have had a transplant in the last 6 months, a bone marrow transplant for treatment of either a blood type cancer or even solid organ cancer such as breast cancer, and others who continue to take immunosuppressive drugs. There are people with respiratory conditions, including such things as cystic fibrosis, severe asthma, and severe chronic obstructive pulmonary disease, who are, really recurrently being admitted to hospital and are difficult to manage. These are a group of patients that we will want to protect. There are rare diseases such as combined severe immunodeficiency, homozygous sickle cell disease, which we're fortunate we have very few patients with that in this province, but these are conditions associated with significant immune suppression. There are a number of groups of patients who take very heavy-hitting immunosuppression therapies that have been a miraculous step forward in the management of their disease, such as rheumatoid arthritis, who are on biologic modifiers that specifically suppress their immune system. High-dose steroids, which most people are familiar, are very immunosuppressive drugs such as cyclophosphamide and azathioprine that are used to suppress people's immune response with these autoimmune conditions. People have had a splenectomy. When you remove your spleen, people are much more vulnerable to different kinds of infections. We know from the literature on COVID-19 that adults with significant developmental disabilities can have increased risk, and more details will come of that particular group. Patients on dialysis or with, pre-dialysis chronic severe kidney disease, stage 5. Women who are pregnant with significant heart disease. We know they appear from our experience across the world to have a higher risk of an adverse outcome with COVID. And finally, there are patients with significant neuromuscular conditions who are at respiratory risk from respiratory compromise from their neuromuscular ability to, in terms of their respiratory status. So a group of patients that range in ages who have a particularly unique, serious risk of adverse outcome. And so we will be working with different provincial registries and specialty clinics to figure out who these individuals are and how we will approach getting them immunized, starting in phase 3. Phase 4, July to September, you've heard that the vaccine will increase again, and this is where we will immunize people from the age groups of 59 down to 18. And you can see in the slide that, as I've described before, dose 1 during 1 month and dose 2 return back for the second dose the following month. And, this will carry on through the summer into September. And we know that by the end of phase 4, which is the end of September, where our commitment to have our broad public immunized, there will likely be a few people that will be still waiting for their second dose into October, but generally we will have achieved a very significant level of immunization. So there are some now logistical issues that I just want to go over that just describe some of the work ahead to get ready for this very broad immunization campaign. Registration. Starting in mid to late February, we will be working to reach out to our elderly seniors over 80 and our Indigenous seniors 65 plus and elders to provide information on how they can pre-register for a vaccination appointment. And we'll be providing an update on this process in the coming weeks. And the communication plan that will be launched in late February will actually have information of when people can be expected to be vaccinated, how and when they can pre-register, and then how they access the vaccination clinic. Enabling pre-registration really allows us to plan better because it allows us to know how to schedule both human resources, supply chain for vaccine, and other supplies that are necessary. So generally, our present approach is that individuals will be able to register 2 to 4 weeks before they're eligible to have their vaccine. And pre-registration for the 79 to 75 age group that will start getting their vaccinations in April, we will start that, therefore, in March 2021. And because not everybody, and especially in our older age group, we have a lot of very active techno-savvy seniors, but there's still some people who are not comfortable with using an online registration, and there will be a call center, a phone mechanism for them to get assistance with registration. I just want to turn now to partnerships. The partnerships that I'm going to just refer to are going to be essential and foundational to our ability to mobilize our public and mobilize our communities to help with a successful campaign. And I think the Premier has outlined just how critical it is that our whole province mobilize behind this whole initiative to get us the protection that we need from this virus in order to get back to business and life as usual. We will be leveraging partnerships with other ministries of the provincial government, local governments, nonprofit groups in the community, the private sector, and others to support the plan. They will have facilities that may be important for us for our mass clinics, such as local governments and First Nations. Some of our civil society nonprofits have networks to reach subpopulations who require special attention to make sure they understand how to get vaccinated, how to pre-register. We will have other services from partners in the private sector who can provide in-kind help, and also skills and expertise around certain parts of this initiative. And I think we're very fortunate in this province. We have a legacy of large, complex initiatives that require involvement of our whole province. And you know, just an example of that is the 2010 Olympic and Paralympic Games, where, you know, one of the most complex events in the year in the world that you have to organize. And we have a huge legacy of people who volunteered for that, private sector businesses who took part in organizing that, and just the people who helped plan that event and pull it off. So moving on to our vaccination clinics. The immunization clinics that we will use in phase 3 and 4 are going to be organized, as Dr. Henry alluded to, in about 172 communities around the province. And those communities have been organized and will be overseen by the local health authorities, and they've been organized to, you know, really be a convenient central location for people to go for their vaccination. And the kinds of clinics we will be holding will include ones in school gymnasiums, in arenas across the province, convention halls, community halls, and any place where we can gather, you know, medium to very large groups of people to do this. There will also be a need for mobile clinics, and not only just in rural settings, but also in some of our urban settings to reach people who are hard to reach, such as in shelters. We've used mobile clinic already in the downtown east side to actually vaccinate people close to where they're gathered and make it safe and familiar for them. And people who are homebound due to mobility issues. The details around those different kinds of approaches will be available in late February and early March. Now, going on to the proof of vaccine, I think everybody likes to know how have they been vaccinated, what vaccine did they receive, what was the date. So everybody who goes through this program will receive a paper copy of their vaccine record, but more importantly, they will be able to sign up for the Provincial Health Gateway that will allow them to access their official immunization card in a digital form. And everybody will understand that their vaccination record is not dependent on them carrying around that paper card, but that it is in the provincial data set now, where every vaccine for COVID will be registered and accessible, ultimately by the individual themselves, by their physician, and by our public health leaders who require that kind of information in order to plan the ongoing control of the pandemic and the history of immunity in the province. So I'm going to turn this back to Dr. Henry to wrap up where we're going to be at the end of all this. Thanks.
Thank you very much. And you've heard us talk about herd immunity, or what I prefer to call community immunity, and that is what we're aiming for in British Columbia. This can be reached if the large majority of people in BC choose to be immunized against COVID-19. And from what we've seen so far, this is something the large majority of people in British Columbia want and are willing to do. And we know that every time we immunize somebody, we're helping to save lives. We're protecting those closest to us and our entire community. But we are not yet at that point where we can lift the restrictions in long-term care or in our communities. And really important for success in us getting through this next few months is continuing to take the precautions that we know work. And that means staying home when we're sick, getting tested, making sure we're washing our hands, covering our mouth when we cough, wearing masks when we're in indoor public spaces, and maintaining our safe distances. And right now, the importance of not having social gatherings, of following the restrictions that we have in place so that we can bring our numbers down in the community today while we're rolling out this immunization program. I would love it to be happening instantaneously, but the reality is that the vaccines that are available around the world are in limited supply, and we are going to be getting vaccine in a back-end loaded way over the next few months, which means we all have to remain vigilant. We need to keep this bargain that we've made with each other, this social contract that we have, to keep ourselves, our communities protected through this next few months as we get towards the light, as we start to see the time when we will be able to come together again, when we will be able to take our masks off. And that is, it is insight, and I think that's important to recognize this well. We have made it this far. We can do this. We've shown we can do this. And so I call on everybody now to redouble your commitment. We have a plan. We know it's going to take a few months, but we have an end in sight. And now's our time to stay committed to doing what we need to do to stop the transmission of COVID-19 here in British Columbia so we can protect everybody with immunization as it becomes available. So I'm going to stop there and say thank you very much, and we're turn it back over to the Premier.